Greetings again from Neocare Clinic and 8TV. We welcome you to our yet another episode of health and lifestyle, where we share with you aspects of health and issues that can affect health. And today we shall be talking about normal menstruation in women and the related abnormalities. We know every woman is supposed to be seeing periods or bleeding every month, and this is normal, and it is expected to start by the age of 9, and between 9 and 12 years every woman should have started seeing periods, and this should continue until menopause. We know menopause usually sets in at around 45 years, which is a range of 40 to 55. So in between 9 years and 45 years, every woman should be able to see periods every month. Okay, and that is what we call a normal menstrual cycle. There are circumstances when a woman's periods may stop or be given a break, and these include pregnancy. During the 9 months of pregnancy, we expect no periods or no bleeding. Number 2, when women are breastfeeding, especially the first 6 months, although some women can go even up to 1 year, but the first 6 months, most women don't see periods when they are breastfeeding. Then there are contraceptives or family planning methods that suspend periods, that give a break to periods for some time. Most of the hormonal methods of family planning, like the injectables, the implants, usually do that. So unless someone is pregnant, unless she's using a hormonal contraception method, unless she's breastfeeding, then she's supposed to see her periods as long as she's in the age bracket of reproductive age, that is between 12 years to 45 years. So what do we call a normal menstrual cycle? This is a cycle that is predictable, that occurs every once a month. Usually in between periods, we should have an average of 28 days or a range of 21 to 35 days. So meaning if your periods come earlier before 21 days or later than 35 days, then that cycle is not normal. So the normal cycle should be averagely 28 days or a range of 21 to 35 days. A normal flow should last about 2 to 7 days. If someone bleeds for less than 2 days or more than 7 days, then that is abnormal. Okay? We expect some bit of pain during menstruation. That is a normal menstrual pain, but it should be mild to moderate. When it is excessive, then that is a problem. And the amount of blood that a woman bleeds during menstrual period should also be moderate. And this is estimated to be about 80 mils or less than 3 pads a day. So if a woman bleeds more than 3 pads a day, or bleeding has got clots in it, it means that is a heavy flow. So the normal menstrual cycle is described as that. It should be every 28 days. It should last between 2 to 7 days. Bleeding shouldn't be very heavy, okay, less than 3 pads a day. Pain should be bearable, and this should start at the age of 9 to 12 years in every girl and should continue until menopause, unless a woman is pregnant or is on a hormonal method of family planning or is breastfeeding. Now, what are those abnormalities that we expect during menstruation? We call them menstrual abnormalities. Some of these abnormalities are related to pain itself. Some women get real excessive pain that is unbearable. Some reach the extent of failing to work or even do their normal daily activities of living, or pain that can disrupt someone's sleep. That is excessive pain, and we call it dysmenorrhea. There are some other abnormalities that can occur during periods. For instance, some people lose sleep, others vomit, others get diarrhea, Others get psychologically disturbed, they get psychotic. All those are menstrual disorders that we can expect. They are rare though and manageable. Now, another disorder that we get is the timing of onset. Some girls delay to start their menses. We expect every girl to have started menstruating by the age of 16. Whereas others can see their periods so early, before the age of 9. So if periods start before the age of 9, we say that is precocious puberty or early menarche. And if the periods appear later than 16 years, then that is delayed menarche or delayed onset of menstruation. Either way, when it happens, such a girl needs to be evaluated by a specialist. In terms of flow, some women can have a real heavy period where bleeding is a lot, changing more than 3 pads, and sometimes with clots. And we call that Menorrhagia. And sometimes this flow can be so prolonged, more than 7 days. If someone spends more than 7 days bleeding, then we call that a prolonged bleeding or a prolonged period. Again, such a woman needs to be evaluated for causes. There are some of abnormalities that may lead to prolonged periods. And it's not good for periods to be prolonged or for a flow to be very heavy, because a woman is losing blood and losing iron in her body, and this can affect her as well. We have also irregular periods. Sometimes periods don't follow this normal rhythm of every 28 days. You find someone who bleeds in between periods, okay? Or someone who skips periods. We call that an irregular cycle or Menorrhagia. There are so many causes of that. Most of the causes are hormonal disorders. We have hormones like thyroid hormones, prolactin hormones. We have male hormones in a condition called polycystic ovarian syndrome. Whenever such hormones are abnormal, then the cycle tends to be irregular. So such a woman with an irregular cycle needs to be evaluated for any of these abnormalities. Another cause of abnormal cycle is extreme of age. Usually, when menses are starting, the first 9 to 16 years, girls tend to have irregular cycles. Sometimes they skip months, or sometimes bleed twice in 1 month, and that is allowed. It's understandable in any girl who is younger than 18 years, because their bodies are still maturing, their systems are maturing, and they don't have a stable cycle. We again see irregular cycles in women who are advanced age, those who are older than 35 years, those who are coming close to their menopause. Again, they start seeing irregular periods. They can bleed twice in 1 month or even skip months, and that's understandable. However, if these cycles are irregular in a woman of normal reproductive age, that is between 15 and 40 years, then we need to look for the cause and treat it. Now, another condition is called amenorrhea. Amenorrhea, that's when someone misses periods consecutively for more than 6 months. Okay, and they are not on any family planning, they are not pregnant, they are not using any medication, but they are not seeing their periods, and they are at an age when they are supposed to see periods. So if a woman misses periods for more than 6 months, we call that amenorrhea. Again, such a woman needs to be evaluated unless she's pregnant, or unless she's using a hormonal method of family planning, or if she's close to menopause. Okay, so these are the commonest abnormalities we see in women. And for pain, whenever a woman presents with excessive pain during menstruation, we have to evaluate her for other causes, like fibroids. We know fibroids, especially those that sit inside the uterus, the ones we call intracavitary or submucosal fibroids. These tend to cause painful periods and also heavy periods. Now, another common condition is called endometriosis. This endometriosis is where the inner lining of the uterus is also located in other parts outside the uterus. You find tissues that are supposed to be inside the uterus can also be seen in other places outside the uterus. And such people really get painful periods. And these are people that we must evaluate for such conditions. The good news is that most of these conditions are treatable. We can easily detect them and treat them so that women live a comfortable life. Thank you so much. Thanks for tuning in, and always tune in to ATTV Health and Lifestyle program every Thursday at 5 p.m. Thanks so much.